The broadcast is now starting. All attendees are in listen-only mode.
Good morning, everyone. Welcome to today's webinar. Looks like we have a good crowd with us and people still joining the room. I know you're all busy, so I want to thank you for taking the time to join us today. I'd also like to thank Great Lakes Computer for helping us put on today's presentation. We hope you find it very useful. We'll be getting started here shortly, but first I wanted to call your attention to a few things. First, you should all have the GoToWebinar dashboard open on the side of your screen. Typically, it opens on the right side of your screen. If you have questions during today's webinar, feel free to drop them into the questions section of the dashboard, and we'll answer them during the Q&A following the presentation. The presentation today should run about 25 to 30 minutes, and we'll follow that with a 15-minute Q&A. I will point out, though, if you have specific questions about HIPAA compliance at your practice, we're happy to take those questions offline as well. So before we get started, let me introduce our panelists for the afternoon. Our first panelist is Eric Dietrich. Eric is Focal Point's leading HIPAA expert and a frequent speaker on privacy issues in healthcare at local and national industry events. He has extensive experience helping health organizations, large and small, meet the burdens of HIPAA and high tech. He is a principal at Focal Point and leads our company's national data privacy practice. Also on the panel is Francesca Sanabria. Francesca leads many of Focal Point's HIPAA-related projects. She's also a respected speaker and innovator in this space. Like Eric, she's a principal in Focal Point's data privacy practice, and she's performed dozens of HIPAA compliance assessments for small and large healthcare organizations in the U.S. She's the IAPP KnowledgeNet chairperson in South Florida and regularly presents at privacy and security conferences around the country. And our third panelist today is Joe Emerson. Joe is a manager in Focal Point's data privacy practice. He manages the on-the-ground efforts for many of our HIPAA clients, as well as leading specialty projects and other privacy disciplines. Prior to joining Focal Point, Joe was an intelligence analyst for the FBI, focusing on counterintelligence, economic espionage, and intellectual property theft. I'd like to thank all three of our panelists for speaking with us today. One other bit of housekeeping before we get underway. I know we have some folks on their first Focal Point webinar, so I'd like to briefly introduce who we are and where we came from. Focal Point was founded in 2005 as a technology-focused risk management firm. We've got more than 400 employees operating out of 17 offices across the US and Canada. We're focused primarily in the areas of data privacy and cybersecurity, identity governance, and data analytics. But our real aim is to provide end-to-end privacy and security services for organizations of all sizes. We've got particularly robust experience in the healthcare space, serving everyone from the largest provider networks down to the small and independent practices that leverage our HIPAA Risk Advisor platform for managing their compliance. As always, you can learn more about Focal Point at focal-point.com. As well, all of the panelists today are more than willing to take conversations offline. We feel privileged to have the opportunity to speak with you today and hope you get some insights that help you put together a HIPAA risk assessment program that works for your organization. Let's take a look at today's agenda. First, we'll dig into recent HIPAA enforcement actions, reviewing some recent cases and seeing what lessons we can take away from those that might be applicable to your practice. We'll also look at the common practices that lead to trouble with annual risk assessments. And then we'll briefly look at the HIPAA Risk Advisor, which is Focal Point's platform for managing ongoing HIPAA risk assessments. And then, as we said, we'll dive into a 15-minute Q&A. And with that intro, I'll turn it over to Eric to get us started this afternoon.
Thank you, Casey. Thanks, everyone, for joining us this morning or this afternoon. We will start off by talking a little bit about some recent enforcement actions that we think bring to light some of the areas that we often see as problematic or challenging for small practices and many organizations as well. So the first one we'll look at here is for the Metro Community Provider Network. They are based out in Denver, Colorado. And while they're relatively large in the sense of the amount of patients they see every year, the incident that occurred is something we see across all size organizations. So they had a data breach that exposed approximately 3,200 individuals via a phishing attempt that came through their email system. One of their employees unfortunately clicked on that, which infected their network, exposing that data. So the settlement ended up being about $400,000 and more importantly, a corrective action plan that'll span many years, where they have to go through independent assessment and audit, and report that back to the various regulatory bodies that were part of this settlement arrangement. Now, if we look at why this is very interesting, is because while it was a phishing attack, and we know that could happen to any organization, large, small, ones that have very complex security and risk mitigation techniques. The incident that actually led up to, I should say, the event that actually led up to the further investigation, ultimately the settlement of that $400,000, was the fact that they didn't perform risk analysis until after the event has occurred, and then they also met that this was insufficient, and wasn't done on a thorough and regular basis. So some lessons learned from this one, and something that we'll talk a little bit more about throughout the discussion this morning, is the importance of performing that HIPAA risk analysis to make sure that you understand where those different risks are within your organization, knowing that you're not going to be able to mitigate all those risks, but being aware of that, going through the exercise, and then potentially changing some practices or some ways that some things are done to help mitigate those risks. So the performance of that risk analysis is a very important regulatory obligation, but then it's also a very important mechanism to identify where those risks might be as it relates to EPHI within your organization. And the other thing, as I mentioned, is the making sure that it's complete and accurate, and making sure that, if you do have to present documentation back around the risk analysis activities that your practice has performed, that you have comfort that it'll be sufficient for the regulatory agency. So that's the first one we'll go through. The next one is CardioNet, and this one, they're a cardiac monitoring service, and using some different devices to help individuals with the cardiac monitoring. So this one's another, while they're a little bit larger as well. The interesting thing here was the cause of the initial breach, which was a stolen employee's laptop. I believe it was out of a car in a parking lot. If you read through the details of the settlement arrangement, and it led to a breach of just under 1,400 individuals. So we all know theft of mobile devices, laptops, or even workstations that aren't secured in an appropriate manner is still one of the number one issues of how EPHI is exposed leading up to a breach. So this could happen to any of us, wherever we might reside, especially with the continued use of tablets and portable type of devices. While those are all great, we need to consider the risks that they pose to our environment. So this one was a very interesting one, where they had to settle for $2.5 million and a corrective action plan. So you could see this is a very high dollar amount, especially for a smaller organization. CardioNet is I believe a couple $100 million, but that's still a pretty large fine. So if we look at this one a little bit more, they had two concerns as they started to investigate, the details around this breach. The first one was around what they felt was an insufficient risk analysis and risk management process that was put in place at the time of theft, specifically around that mobile device, or as they classify as a mobile device, that laptop. And then the other interesting thing that we'll talk a little bit more about is that as they were starting to review the CardioNet policies and procedures that were implemented that to show their alignment to the security rule, they were in draft form, and they weren't officially implemented across the organization, meaning that they weren't communicated or available to the employee base in an easy format, or the employees really understood what those practices were. So this is another theme that we'll talk more about, the importance of having documentation to support all the activities you do to protect that EPHI, but also the importance of making sure that documentation is accurate, complete, and is available to your employees. So it's an interesting one here that settlement came about due to the risk analysis not being conducted in a thorough manner, and then the lack of formally implementing policies and procedures and making sure they're put into practice. So as we think through that, don't always assume that this is just a paper exercise that needs to be done and it's there sitting on the shelf. It's very important that those policies and procedures reflect what you're actually doing in practice, hopefully good practices that protect the data and align with those HIPAA requirements, but not also overstating things in there that you just have no capabilities to perform, especially at a smaller practice. Okay, so if we think about some of the themes that come about within those two enforcement actions, and while those events took place a few years ago, these were enforcement actions that were just settled on and agreed upon this year. So that's the other thing you could see, that the amount of time that you might be negotiating and around the settlement arrangement, trying to defend your position could take years, and that's not something any of us want to get into, no matter the outcome of those breaches or the events that lead up to it. So the two key takeaways that you probably gathered from our discussion so far would be around the lack of doing a risk analysis, or a risk analysis that didn't meet the intent or the thoroughness that's expected of the regulators. The next one would be that it's being done timely, it's being done in a periodic manner, and you're not waiting for an incident or a request from an investigation to when you perform that. And that's true with the policies and procedures as well. There was a greater theme over the last year or two from OCR that they didn't want to get what they called wet policies, things that were just drafted for them based on specific requests that might come through an investigation. So it's very important to have these things in place, understand where your risks are, have documentation that's accurately reflects your environment, so that you can respond in a timely manner to the incidents that might be occurring. Okay, so that brings us to our common practices that we wanted to go through and talk a little bit. So we've pulled together 5 of these that we think will be helpful in understanding what those risks are, and areas of these common pitfalls or practices that might lead to some of these concerns. So I'll just start with the first one here, and then we'll have the various focal point team members join in as we continue through. So the first one is very related to the last comment I made about some of the themes of those enforcement actions, but the idea of cookie cutter HIPAA policies and procedures, and then also signing up for more than what is done in practice. And what we mean by that is that certain times, and it makes sense, where a small practice will either purchase or download templates, especially HIPAA security style policies and procedures, which provide a very good baseline to start from. But often we see too often, many cases where there's more of a fine replace of a name without a thorough evaluation of what those statements are within those policies and procedures, what practices are being stated as being performed within those documents, and that could often lead to you having the documentation that defines activities that you just can't do as a small practice. You might say that there might be a policy in there that's geared towards more of an enterprise environment where they have a large IT organization, a help desk, and mention certain practices for provisioning user accounts, that it gets approved by HR, that it gets created by your IT help desk, that approval is kept in a ticketing system. And while all those things might happen at a smaller practice, most likely it's a much more streamlined process that somebody within the practice is acting as that within those functions, and it might be one person doing 5 different functions. And so those policies and procedures really need to be reflective of your specific practices, activities, especially around the IT environment, and making sure that you're only signing up for what is really needed for alignment to the specific HIPAA security rule requirement, and is giving a clear picture on those activities. So we give a word of caution that it's okay to start from baseline templates and work from wording that's already out there around some of these topics, like asset management, provisioning of user accounts, backups, things that are very common for small and large organizations, but making sure that you do spend the time to make them reflective of your organization. Otherwise, it can make it even more challenging later on down the road when you're trying to defend certain positions and so forth. So now we'll go on to the next one, and I believe Joe will chime in on this one.
All right, great. Thanks, Eric. So the second one here is misunderstanding of IT responsibilities, and as a smaller practice, it may not be as common to have an IT personnel on site at all times, or certainly kind of a full suite of IT working with you to help ensure that everything is working as it should, and the controls related to the HIPAA security rule are in place. So having a third party or a vendor working with you is certainly an excellent option, but it's important to have that understanding of the roles and the responsibilities of your outsourced IT function as it relates to your roles and responsibilities as the practice, right? So, a good example of this is user access management. You can have the IT vendor help set up and create those accounts. However, they still need to go through that policy and procedures that Eric was referencing earlier, making sure that they go, that the accounts before they're set up, get the appropriate approval, as well as making sure that access is still continuously reviewed. And we often see that these smaller organizations fail to do any user access reviews, either because there's very limited turnover or they just have a very small organization. But it's important to make sure that we have that evidence that shows that we're still performing these reviews in case of any audit. And another situation to look at is cloud source, using cloud environment and making sure that we have the security controls that are in place that they require, so that we are following any agreement, the business associate agreement or contract that we have signed with them. For example, AWS, you have certain steps that you have to take and certain controls that you may have to enable yourself. So ensuring that you work with your IT vendor and have that understanding to make sure that these controls are enabled, like encryption or audit logging, so that we can maintain those security controls. So okay, I think, Francesca will take the next one.
Yeah, I'll get that one, Joe. Thanks for the insight there on the understanding of those IT responsibilities. So the next one we have here is number 3, which is inadequate security training programs. So this is another area that often gets overlooked, or not enough importance put onto it, especially at smaller organizations that we get exposed to. So a lot of times, we'll see an organization might have some training material around the do's and don'ts of the appropriate use, access, disclosure of different PHI or EPHI, and maybe it's given at onboarding of a new employee. Maybe it's given on an annual basis in a little better cases, but often the shortfall is around the periodic refreshers and making sure that everyone understands that the risks and the threats that are out there continuously evolve, and only doing yearly training, formal kind of training, definitely has a gap in its ability to be effective among your employee base and ensuring that people stay aware of what those risks are. So a good example we like to see here is around phishing attempts, and whether it's through email or even phishing attempts through phone calls as well. But just ensuring that your employees are trained, and one good way is to do phishing type of scenarios where you send out emails with phishing attempts to your employees. There's tools out there, there's different companies that could help you with that. And then you try to see if your employees are trained and are aware enough to realize that, hey, this might not be a real email. Maybe I shouldn't click on the link that's in there. Are they skeptical of what they're receiving on an attached document and so forth? So the periodic reminders, periodic refreshers, are very important to your employee base, even if it's only a handful of people. That is very helpful to do that. So as you think through how you keep your employees aware, even if it's just sending out periodic reminders, talking about it around lunchtime one day, downloading some information on the latest phishing attempts. There's a lot of different websites that could be accessed. So there's a lot of different things that don't necessarily cost a lot of money, don't necessarily take a lot of time away from your employee base, that could help raise that awareness. Because one of the greatest threats to small organizations right now is these phishing type of attempts, and the ability to get access to certain files that might lead, or certain elements of your network or your systems that lead to these breaches. Okay, so we will move on to number 4 here, which I believe Francesco will talk a little bit about.
Yeah, so another common practice that we see in small offices, we understand why, as we're setting up such an environment, we may not have all the technology available to set up perhaps some more sophisticated tools and softwares and such. But I think data handling practice, the way we are handling the data and what technology we're choosing, becomes really relevant from a HIPAA perspective, and as you're protecting that. And we've seen some small offices that they're using personal emails, or the use of Gmail, or in not corporate accounts, and Hotmail and AOL, right? To use that as a way to communicate among the practitioners and the nurses and staff, and sometimes even to communicate with patients, right? Where I think from a best practice perspective, not avoiding any type of EPHI being processed via email with the patients, even if a patient decide to email, not replying to that, and making sure that everything is done over the phone and by and in person. And if they want copy of medical records, that do that separately and not being sent that via email. So that becomes important. And also, we've seen that some small offices sometimes they're being conservative, so they want to keep a backup. So besides having the information in the workstation, they may bring a separate hard drive that you can buy anywhere, and use that like a personal external hard drive to have a backup of the information, which is great from a backup perspective, because you're maintaining a backup of that information. However, that then represents a different risk, as then you have that personal drive that is probably not encrypted, that then can get more easily lost and be accessed by anybody else in case that it gets lost. So I think what we recommend here is making sure, again, limit the use of email and personal drives, and then limit the amount of EPHI that can be in external drives, and the use of USBs and such, and limit the amount of communications that can be done with patients via email around EPHI, making sure that those are handled at the practitioner's office.
Great, and that leads to number 5, which is around some areas that we touched on when we've been talking through those enforcement actions, and that would be around the scope and frequency of performing a HIPAA risk analysis. So, on a regular basis, and traditionally that turns into at least on an annual basis, the performance of a risk analysis should be done, or upon any material change to your business or your IT environment. So if you go from one small location to maybe 2 or 3, that would probably be viewed as a material change that would trigger the reperformance of a risk analysis. Or if everything is relatively status quo throughout the year, doing them on at least a yearly basis will help as you think through ways to mitigate the various risks and align with those HIPAA requirements. So frequency is very important, as well as the scope. Something we hear quite often is, especially a smaller practice, that, hey, we outsource most of our functions, including maybe billing, we outsource our IT, so why do we need to do a risk analysis? But according to the requirements, a covered entity, even a small covered entity, are required to do a risk analysis, and then you take into consideration all the functions that are outsourced. So it might be a much more simplified process. You might have to gain information from those third parties, because it still is the obligation of that covered entity to ensure the relationships that they have established to perform certain functions and activities on their behalf are still aligned with the HIPAA security rule. And yes, with the change that occurred a few years ago, the regulators could go directly after a business associate for violations of HIPAA, but it's also still the responsibility of the covered entity to maintain that oversight and so forth. So to understand those various risks that might be associated with those vendors and contractors, performing that risk analysis is a very important thing. Okay, so that gets us through those top 5. So we'll just spend just a few more minutes talking about our HIPAA Risk Advisor platform, just walking through what the steps are in that and how it could potentially be used, especially for smaller organizations, to one, meet the obligation of performing a risk analysis, but then also getting insight into where those risks might be within your organization or within those third parties that you have helping. So the Focal Point's Risk Advisor platform is a SaaS solution, a web-based tool that could become available to you. And basically, it has a few different features. One would be the initial portal, which has some knowledge-based type of documentation, including, like we mentioned earlier, some templates that can be used to start those policies and procedures, but definitely need to be adjusted accordingly for your specific practices. It has access to general HIPAA training material that could be customized and used within your organization. And then most importantly, it has the ability to do a semi-self assessment. And we call it the semi there because there is interaction with our team, our HIPAA subject matter experts throughout the process. So it's not just a tool where you fill it out and you're kind of left in the dark. There is some hand-holding and some insight provided by HIPAA subject matter experts on the Focal Point team. So on this slide, we walk through that on what that process means for that HIPAA assessment. So it starts with the ability to download various training material and policies to get ready. But then the assessment starts with our questionnaire that gets sent to you in, like I mentioned, a web-based format that you log into the website, and then you go through a series of questions. It provides the ability to upload supporting documentation. So at those various phases and topics that are being asked about, it'll ask for you to upload the respective policy and procedure that you have, if you have it. If you don't, then that comes back as potential areas of enhancement and so forth. Once all that information is completed within that questionnaire, one of our HIPAA compliance experts will go through, review the questionnaire, look for either missing items, look for things that are inconsistent or potential risk areas. Our team members will schedule a call with your team to go through those questions that we have. Usually that's a 1 to 2 hour web conference that we have to walk through there, answer any questions you have, get to different points of clarification. Then we come back, we take that information that's learned, we enter that into the tool that we have, and we ultimately finish up the analysis and issue a report. And then we'll share that report with you, and that provides you insight into the overall findings, risk areas, potential areas of enhancement. So at a high level, that's the process that we go through. And this provides a little bit of insight into those activities. So I'll just click through these couple slides to provide you details on those various phases of this. So this is the self-assessment. You can see it's a relatively user-friendly interface that asks questions that are relative to the HIPAA security rule, and then provide the upload capability directly within each question to make it a simple and efficient process to complete. Then, as I mentioned, we review these activities, especially the policies and procedures that have been uploaded, to look for their relevance and the importance of those policies in respect to the requirement that you identified it for. As I mentioned, we get on the phone with your team. We go through, before issuing the report, we go through any questions. We ask details about those policies and procedures that were uploaded. We ask about any potential things we're starting to see as a risk area to make sure we clearly understand what you do at your practice and how you do certain activities, so that by the time we get to the analysis part, we're able to go through this in a relatively quick timeline, usually within a week, and then we're issuing a report back. And the report has a few different features in it. One, it provides details into those specific observations and findings, or gaps, as you might call them. But then it also provides dashboard capabilities and a dynamic risk score that help you understand where those critical risks are, where are things that are fully addressed, not fully addressed, knowing that you might always have some risks in there. You might never get to 100%, but the goal should be that you get that risk score to an acceptable level, as deemed acceptable to your organization, but usually in the upper quadrant of that scoring scale. And we provide you with recommendations on areas that can be enhanced or implemented to further drive up the dynamic risk score. So it's a robust platform that's very efficient. You get the HIPAA compliance experts involvement at a very reasonable price. So with that, we will open it up to questions at this point. And I believe Casey, we'll see if we have any questions that have come in, and we'll address those.
Yeah, I appreciate it, Eric. And thanks also, Francesca and Joe. We do have a few questions here. I'll throw them out one at a time and let you guys jump in with your thoughts. A reminder to people in the room, it's not too late to submit questions. So just saw another one just come in. Just drop them in your GoToWebinar dashboard, and I'll queue them up with the panelists. So the first question, we only have one office and everything is in the cloud. Do we need a disaster recovery plan?
All right, I'll go ahead and take that one. It's always important to have a disaster recovery plan developed and instituted so that everybody has an understanding of where the systems and applications are, even if they're in the cloud, like in AWS, understanding of how to access that and where to access the different contracts and verbiage, so that we have the understanding of where and when we can expect the recovery time to take place, right? They certainly do not have to be as detailed as a disaster recovery plan for a much larger health service of multiple offices, or multiple states even, perhaps. So we do benefit from that, and that's for sure. But it is important for us to have some kind of documentation stating what our objective is and how to obtain that as it relates to the disaster recovery plan.
Excellent. Thanks. Good answer. Second question coming in. We have never performed background checks before. Is this something we need to do retroactively?
Yeah, I'll do that. So yeah, I would say for sure. I think definitely from a HIPAA security perspective, there's a key requirement around workforce security. So which a lot of that is around how you're vetting and the users and before they're actually getting access to EPHI. So besides focusing on having an onboarding process around user access provisioning, another key thing that needs to make sure that it's happening. It's a background check on your employees and making sure that that's being done as part of the overall HR onboarding, and then you can kick off the after that passes and the employee starts, then you will do the regular user access provisioning process.
Thanks, Francesca. Next question from the crowd. In the event of a breach, does using a tool like Focal Point then limit the fallout on the back end because you have made a good faith effort to prevent breaches?
Yep, and I'll take that one. So I think the short answer would be yes. And the activities you would go through would be would show that you went through the risk analysis, you identified any potential risks and vulnerabilities, and that you had things in place, hopefully, to cover the risks around a large majority of those areas, and then potentially even identify areas that could be further enhanced, and you would have documentation to support that. So I think if you came back with a very high score, you came back with a very positive report, that would absolutely be something that could be used to show you made a good faith effort, that you were proactively making steps to mitigate those various threats and risks to your organization as it leads to a breach. And then knowing that even if there were some areas of enhancement, as long as you took some steps to maybe enhance a process, enhance a technology, or at least put a plan in place to further mitigate those are all viewed positively by any type of investigation. I'm not saying it's going to say, hey, we made an effort, we had a breach, and there's no risk or no liability. That's not the case as we sort through some of those corrective action plans, but it's taking that proactive approach and having a platform to do it in a systematic way, and in a way that could help document the activities that were performed, all things that the Focal Point tool could help with.
Great. The next question is a big picture one, maybe for you, Eric. What percentage of practices would you say are not at some level of HIPAA compliance?
I think there's a large majority of organizations that we see that have areas that could be enhanced from a HIPAA practice. I would say it's very uncommon for us to walk into a small or a mid-sized organization, or even very large organizations for that matter, that don't have an area that could be further enhanced from a HIPAA compliance standpoint. And the important thing to remember is that it's continuously evolving. While the standards don't change that frequently, meaning the requirements don't necessarily change. The omnibus rule, which took effect a few years ago, or the most substantial changes made in quite some time. But the threats and the risks and how the regulators expect you to react to those definitely changes. So even if you were good 5 years ago, but you've become a little stagnant and you haven't done much in those 5 years, then you could easily fall out of alignment today. So yeah, I would say it's a pretty low percentage where we go into an organization and they don't have, and they're fully kind of aligned and they have a very strong program in place. So if you fall in that bucket, you're not alone. But that also doesn't mean that the risks aren't growing to small practices, and it's going to become more and more important to be able to demonstrate your alignment to the HIPAA requirements.
Great, thanks. We've got two more questions here. Before I ask the next one, I will remind everyone in the room, if you have questions, we still have another 3 or 4 minutes where we could squeeze in probably one more if you want to drop it into the questions section of your GoToWebinar dashboard. All right, next question. For a small company that does not have a large staff or number of systems maintaining EPHI, what are the top 3 immediate items we would need to address to start our road to compliance?
Well, I would say we can see this from 2 different lenses. I mean, if we want to avoid or if we want to be ready for a OCR audit, and knock on wood, none of us have to go through that. The top 3 things that and they would ask is to see your policies, evidence of training, and evidence of your annual risk analysis. So, and I know we talk about some of how to manage some of these before, but I think that's something very important, having realistic policies that are customized for you, and that that we're signing up for things that we are actually doing in practice. And I think as those policies are being put together, we would identify certain controls from a technical perspective that will have to be put in place, and I know we talk a little bit about some of those around in the use of email and data handling practice and such, and then some type of evidence that we can keep that all our staff is getting an annual security training, not only upon onboarding, and I know Eric touched a little bit on that security program, but at a minimum making sure, even if it's just with a PowerPoint deck, and we have a Excel training log, which is a sheet, and everybody signs where they're taking that training. That will be important, because you're proving that you're doing enough to prevent that. And then the risk analysis, and we know we talk about the HRA tool, and there are also ways to do that through an Excel and a manual where you're demonstrating that you're evaluating your threats and your environment every year. But if you don't have those policies and you don't have that training, and all the results of your risk analysis are going to become in the higher risk, and then so I think building that foundation become important.
Great. On to our last question here. What are the benefits of outsourcing a risk assessment if we can just create some policies and provide some training on our own?
So I can go ahead and take that one. It's a real benefit to have a third party or have your risk assessment outsourced, so that you can get a fresh look at the different threats and your different controls and understanding of the mitigation that's in place there, right? So when you think about it, especially if you've become comfortable with your controls, and you have your strong IT vendor that you've brought in, they often will become, like I said, complacent in thinking about the different threats, and again, complacent in the strength of their controls. When you have a third party come take an outside look, you get a stronger understanding of which controls are really in place, what exactly the threats of our environment are. It's always nice to have a fresh pair of eyes taking a look at the environment, so that you have that greater understanding of really where do you stand. And then the third party can work with the IT vendor and the practice as well to have that discussion and like I said, the more complete understanding of the entirety of the environment and the security controls.
Great, thanks, Joe. Well, that should wrap up our Q&A for today. Again, I'd like to thank our panelists, Eric, Francesca, and Joe, as well as our sponsor, Great Lakes Computer Corporation. And most of all, I'd like to thank you all for attending the webinar today. As a reminder, we'll be sending everyone a link to a recorded version of the webinar tomorrow. We'll have it posted on our site as well. As always, feel free to check out additional HIPAA resources at focal-point.com. Thanks again, everyone on the call. We hope you all have a great day. Thanks.